Between 2019 and 2023, nearly 14,000 minors in the United States received medical interventions for gender dysphoria. At the time, these procedures were promoted as the standard medical protocol for children and adolescents. Backed by major medical organizations like the American Academy of Pediatrics and WIPATH, this affirmative model relied on three main pillars: rapid social transition, the use of puberty blockers, and the administration of cross-sex hormones. But as procedure numbers climbed in the U.S., international health authorities began reversing course. Independent evidence reviews in the United Kingdom, Sweden, and Finland found weak benefits compared to high risks, leading them to restrict these treatments to tightly controlled research settings. That skepticism soon appeared at the state level in the U.S. Officials in Texas and Florida began framing these treatments as a form of child abuse, directing Child Protective Services to investigate both providers and parents. The result was a policy vacuum that left the country fractured. Families found that the legality and medical necessity of their care changed completely the moment they crossed a state line. This tension set the stage for a federal intervention. The perceived medical consensus was about to be dismantled by the government's own data. When national policy disruptions collide with local healthcare standards, independent reporting becomes essential for finding clarity. That's why we recommend Shasta Unfiltered. They provide honest news and entertainment for the North State, focusing on the facts that matter locally. Scan the code on screen or visit their website to subscribe today. In November of 2025, the U.S. Department of Health and Human Services released a 400-plus page peer-reviewed study commissioned by a presidential executive order. The report delivered a blunt assessment. The evidence for pediatric gender-affirming care is of very low quality. After reviewing systematic studies, researchers found no robust proof that blockers, hormones, or surgeries actually improve mental health or reduce suicide risk. The report detailed significant physiological harms. Because puberty blockers halt gamete development and over 90% proceed to cross-sex hormones, it frequently results in permanent sterilization. Damage extends to impaired bone development and irreversible removal of healthy tissue, causing loss of sexual function and lifelong medical consequences. The data indicates that the pause button narrative of puberty blockers is medically inaccurate. These interventions often lock children into a pathway that prevents natural development and causes permanent harm. A major component of the HHS report focused on the natural progression of gender dysphoria when medical interference is avoided. This chart shows the rate of natural resolution. Data cited found that over 70% of adolescent females diagnosed between ages 15 and 19 no longer met criteria for gender dysphoria 5 years later, provided they progressed through puberty naturally. The report is particularly critical of how this evidence was sidelined. It accuses WIPATH and the Endocrine Society of suppressing systematic reviews that undermined their preferred treatments and removing age minimums under political pressure. By relying on these flawed documents, U.S. medical associations created a false perception of professional consensus. They prioritized aesthetic affirmation while marginalizing comprehensive psychotherapy and non-invasive psychosocial approaches. The affirmative model was an experimental approach that prioritized immediate transition over the long-term safety and natural development of children. The legal response was immediate. By 2026, 27 states had enacted laws or policies to limit or ban gender-affirming medical interventions for minors. These laws carry severe consequences. In several states, providing these treatments is now a felony, resulting in professional discipline, license revocation, and the loss of all public funding. The U.S. Supreme Court's 2025 ruling in United States v. Scarametti upheld these restrictions. By affirming state authority in this area, the court removed the primary legal barriers to further bans. In contrast, California remains a sanctuary state for these procedures, treating them as a protected right. However, even there, practical availability has narrowed, as federal funding pressures and the HHS findings create a new environment of provider caution. This has left the United States legally split. A medical practice considered a protected right in one part of the country is now classified as criminal misconduct in the other. Moving forward, the HHS report mandates a shift in priorities. The focus is returning to thorough psychosocial evaluation and treating underlying issues like autism, trauma, or same-sex attraction. The era of unquestioned medicalized transition for minors is being replaced by a model that prioritizes developmental evidence and non-invasive care. For the report's authors, this transition is the only path toward evidence-based medicine and the only way to protect children from known irreversible harms.